I want to describe the situation in Georgia, very short information about the coronavirus cases for today. It's more than 2,000 cases for today. Here is information from September 11. So the cases in Georgia was increased, started from the June, and it's depend on the situation because the Georgian, the local tourism in Georgia is very was opened in June, and we have the many resorts. It's the mountain resorts and the seaside resorts, and so after this, the cases grow up. And for today, we have 2,500 cases. A daily number of cases is more than 100 for these last 10 days. So the whole situation about the lockdown was started in March, and so it's include all the steps of lockdown, and the all information is here provided in my presentation, and so it's the same situation was as in other countries. Please, the next slide. The all measures on pandemic measures was started from the January of 2020, and by step, this includes the very many activities and description of these activities provided in this slide. And on the next slide are the activities when the lockdown situation was lifting, and reopen the all institutions, all and the life in Georgia is coming as normal situation, and after this, the number of cases is grow up. So next slide. Next. I want to say about some restrictions about the traveling in Georgia. The country is open only for 5 countries: is France, Germany, and countries of Estonia, Lithuania, and Latvia. Now I want to say provide some information about the immunization schedule of Georgia. We are So I have the problem. It's not my problem about the microphone, but I'm hearing the other sounds. Please, can the person who are not talking to mute their microphones? So it is our immunization schedule, and we are using 11 vaccines against the 13 infection disease. So during last from 2002, Georgia introduced in their immunization schedule 7 new vaccines. Many of them was provided by Gavi support. And the last introduction, it was the HPV vaccine. It was introduced first we used the demo project from 2017, and in 2019 it was the countrywide introduced. And the last new vaccine introduction was in this year. We changed our schedule, and country introduced the tetravalent vaccine, including the inactivated polio for the vaccination at 8 months and 5 years. So next slide, please. This is a vaccination coverage comparing the data from 2019 and 2020, this data for 6 months, and there is all antigens which are in our immunization schedule, and I'm sorry, it was difficult for me to make the translation in English, so the situation like this. So there is data 19 and 20. Next slide, please. And you can see that it is a forecast for this year, and so the vaccination was little bit decreased. average percent is 7% for all antigens. Next slide. So by when the pandemic is starting, as the cases is grow up, we use the WHO in March. We received the recommendation from WHO. It was a guideline how to continue the immunization during pandemic, and the government and the Ministry of Health prepared the guideline based on these recommendations, and it was approved as the decree of Ministry of Health and was shared for all health facilities how to continue vaccination. There was many changes because we changed the working hours in facilities, and so this speed on this, the coverage rates do not increase, and so now we are decide to introduce some more activities. Next slide. It was we developed the micro plans for all district level facilities, and it was calculated how many unvaccinated people they have. After this, we conduct during all this period the supportive supervision activities in most affected areas, and it's very good the option for I recommend it to all my colleagues to conduct these types of activities. After this, we are using we are now in the as a transition country, and we are receive the post-transition grant from from Gavi, and using these funds, we prepare the training course for all health facilities representatives on the interpersonal communication, how to conduct this vaccination, and so these trainings now are go on, and so I think it will be help to increase the immunization coverage, and to share all needed information and how they can invite the parents, how to communicate it with the doctors, and like this. So we are using our immunization management, electronic management module to checking the immunization coverage data, and so we have the all information by using this electronic system. We are conduct the communication activities, and so we have the hotline during this pandemic, and it was developed in the previous year, but it's now is very actively working, this hotline, and we have the we receive all information. The parents and all person can receive all information about the vaccination, how they about all issues what they are interested in. And so I want to add all of you know that now the influenza season is started, and so we'll provide as in previous years the flu vaccination for all risk groups, and I want to add about the future COVID vaccines that Georgia decide to participate in the COVAX facility, and so we also signed the letter of intent in this facility, and we hope when the vaccine will be available, we will start the vaccination of COVID. And so I hope the pandemic will be help to decrease the cases. It's our the immunization Facebook page, so it's working during 24 hours, and the specialists from NCDC provide all needed information for parents, and this is very important during this pandemic. And so also this is our page. This is Stop GovG. It's on working on 5 languages, and so all interested person can receive information about daily situation in Georgia. Thank you.